make the point that as integrative healthcare providers, we seek to identify root causes and to treat each person individually and holistically. But there's nothing cheap about identifying symptom patterns and phenomena and allowing the treatment to flow from there, especially early on in your treatment relationship. While you're pursuing identification of the root causes with some of the more time-consuming diagnostic tests, it's often strategic to get on first base, so to speak, with a helpful nutraceutical intervention that takes place during the first month or two of treatment. More than most classes of nutraceuticals, you will have or can have cytochrome P450 and other biokinetic effects. Also, in my experience, and it's somewhat in the literature, perhaps greater than the use of SAMe and some of the amino acid products and antioxidant products, you'll have allergic reactions and asymptomatic mild elevations of LFTs. You really need to, know the benchmark constituent or constituents for each of the botanical products you're using, since it can be quite mind-boggling with the multitude of preparations that are available. Patients will change the products from time to time. There's something on sale. And if you can, U.S.-made products with certifications and organic are generally more reliable, but not always available. I approached this matter with trepidation a decade or more ago when I began a more substantial integrative psychiatric practice, because everyone has an opinion about what is safe and not safe for a fetus and for a woman during pregnancy. And, caution is in order. But, the same doctors who would dismiss the use of SAMe perhaps for women who are seriously depressed during pregnancy would think nothing about saying, to take a full dose of an SSRI, which can also be effective for depression during pregnancy. So keep in mind you're dealing with a precious person at a special stage of her life, and the fetus as well. And before you even consider any biotherapies, you want to, be the one, if no one else is doing it, to look at nutrition, the psychosocial, both the strengths and the stressors, and the psychological. Botanicals, you want to use them for depression, anxiety, and insomnia. You want to be mindful of their special properties. Regarding special patient populations, they actually have more in common than first meets the eye. And so your integrative holistic care will take place within the context of a village of significant others, a tribe of other healthcare providers. They're often more complex and delicate than your other patient populations. And seniors and the medically ill are simultaneously delicate and treatment resistant.